Welcome back to our channel. Today, we'll be discussing a viral illness that garnered global attention a few years ago and is still a matter of concern in some parts of the world. MERS, or Middle East Respiratory Syndrome. So, let's dive in and understand what MERS is all about. What is MERS? MERS stands for Middle East Respiratory Syndrome. It is a viral illness caused by a coronavirus known as MERS-CoV. The disease was first identified in 2012 in the Middle East, hence the name. MERS is considered a zoonotic disease, meaning it can be transmitted between animals and humans. Camels are considered the primary reservoir for MERS-CoV. Brief history of MERS. Middle East Respiratory Syndrome was first identified in 2012 in the Arabian Peninsula. The initial cases were reported in Jordan and Saudi Arabia. The virus responsible for MERS is called MERS-CoV, which belongs to the coronavirus family. The first known case of MERS occurred in June 2012 in Saudi Arabia. The patient, a 60-year-old man, presented with symptoms of severe respiratory illness and subsequently died. Throughout 2012 and subsequent years, the number of MERS cases gradually increased. The majority of cases were concentrated in Saudi Arabia, although cases were also reported in other countries in the Middle East, including the United Arab Emirates, Qatar, and Jordan. One significant outbreak of MERS occurred in 2015, when South Korea experienced a large number of cases due to a traveler who had been infected in the Middle East and brought the virus back to the country, resulted in hundreds of cases and several deaths. MERS-CoV has continued to cause sporadic cases and small outbreaks in the years following its initial identification. Efforts have been made to improve surveillance, control measures, and public awareness regarding MERS. About causal agent of MERS. The causal agent of MERS, known as MERS-CoV, Middle East Respiratory Syndrome Coronavirus, is a member of the Coronaviridae family. Coronaviruses are a group of enveloped, single-stranded RNA viruses that can cause respiratory and gastrointestinal infections in animals and humans. Its overall shape of virus is roughly spherical or pleomorphic, with a diameter ranging from approximately 80 to 160 nanometers. The outermost layer of MERS-CoV is the viral envelope, derived from the host cell membrane during the process of virus budding. This envelope consists of club-shaped spike proteins, which give the virus its crown-like appearance. The spike proteins, S, play a critical role in viral entry into host cells. Viral genome consists of single strand of positive sense RNA which is enclosed in a helical nucleocapsid. The genome of MERS-CoV is approximately 30,000 nucleotides long and encodes several viral proteins involved in the virus's life cycle. The RNA genome of MERS-CoV is associated with nucleocapsid proteins, forming a helical ribonucleoprotein complex, which helps protect the viral RNA and plays a role in the replication and packaging of the viral genome. How MERS transmits? MERS primarily transmits through close contact with infected individuals or animals. The main modes of transmission include respiratory droplets. When an infected person coughs, sneezes, or talks, respiratory droplets containing the MERS-CoV virus can be released into the air. These droplets can be inhaled by individuals in close proximity, leading to infection. Direct contact. Close contact with an infected person can also lead to transmission of MERS-CoV. This can occur through activities such as shaking hands, hugging, or taking care to an infected individual without using proper PPE. Camel-to-human transmission. Dromedary camels are considered the primary reservoir for MERS-CoV. Close contact with infected camels or their bodily fluids, such as during milking, slaughtering, or handling their carcasses, can result in transmission of the virus to humans. Healthcare settings. In healthcare settings, transmission of MERS-CoV can occur through contact with infected patients or contaminated surfaces. Healthcare workers who do not use PPE and do not practicing hand hygiene are at higher risk of acquiring the infection. It's important to note that while human-to-human transmission of MERS-CoV can occur, it is generally limited and does not sustain widespread community transmission. For individuals traveling to or residing in areas where MERS has been reported, it is important to stay informed about the current situation, follow any travel advisories or guidelines issued by health authorities, and seek medical attention if experiencing symptoms of respiratory illness. Pathogenicity of MERS. The pathogenicity of MERS refers to its ability to cause disease in infected individuals. MERS-CoV primarily affects the respiratory system, targeting cells in the lungs and airways. The virus gains entry into host cells by binding to specific receptor molecules called dipeptidyl peptidase 4, DPP4, which are expressed in the respiratory tract and other tissues. Once the virus enters the respiratory system, it begins to replicate and spread within the host. This replication process leads to damage and inflammation in the respiratory tissues, which can result in various respiratory symptoms. One of the factors contributing to the pathogenicity of MERS-CoV is its ability to evade the host immune response to some extent and potentially leading to more severe illness. Certain individuals may be at higher risk for severe MERS outcomes, including older adults, those with underlying medical conditions, such as diabetes, kidney disease, or weakened immune systems, and individuals with compromised respiratory function. Efforts to understand the pathogenicity of MERS-CoV and develop effective treatments and vaccines continue. What are the symptoms of MERS? The symptoms of MERS can vary in severity, ranging from mild respiratory symptoms to severe respiratory illness and organ failure. The incubation period for MERS-CoV is typically around 2 to 14 days. Common symptoms of MERS include fever, cough, shortness of breath, chest pain, sore throat, muscle pain and fatigue. In severe cases, MERS can progress to more serious complications, including pneumonia and acute respiratory distress syndrome, ARDS. Some individuals may also develop kidney failure or other organ failures, which can contribute to a more severe illness course and a higher risk of mortality. If you have recently traveled to or reside in an area where MERS has been reported and develop symptoms such as fever, cough, and difficulty breathing, it is important to seek medical attention promptly. How to diagnose MERS? The diagnosis of MERS involves a combination of clinical evaluation, laboratory testing, and assessment of the individual's travel history. Here are the key steps involved in diagnosing MERS. Clinical evaluation. Healthcare providers will assess the individual's symptoms, medical history, and any known risk factors, such as recent travel to MERS-affected areas or contact with infected individuals. Molecular testing. RT-PCR is the primary method used to detect MERS-CoV RNA in respiratory samples, such as nasopharyngeal swabs, throat swabs, or sputum. This test identifies the genetic material of the virus and provides a definitive diagnosis. Serology. Blood tests may be conducted to detect the presence of antibodies against MERS-CoV. However, serological tests are typically used in later stages of illness. Travel history. A thorough assessment of the individual's travel history, including recent visits to MERS-affected regions, and potential exposure to infected individuals or camels is crucial for the diagnostic process. Consultation with public health authorities. In suspected or confirmed cases of MERS, healthcare providers may need to consult with local or national public health authorities for guidance on diagnostic testing, management, and infection control measures. How to treat MERS? Currently, there is no specific antiviral treatment for MERS. Treatment primarily focuses on supportive care to manage symptoms, prevent complications, and maintain overall health. Here are some key aspects of MERS treatment. Hospitalization. Severe cases of MERS often require hospitalization, especially if there are respiratory distress and complications. Hospital care allows close monitoring of the patient's condition and the provision of necessary supportive interventions. Supportive care. Supportive care include oxygen therapy, fluids and electrolyte management, fever and pain management and respiratory support. Prevention and management of complications. Healthcare providers focus on preventing and managing complications that can arise from MERS, such as pneumonia, acute respiratory distress syndrome, ARDS, and kidney failure. Investigational therapies. Various experimental antiviral therapies and immunomodulatory drugs have been explored in the context of MERS, which may be considered on a case-by-case basis, under strict protocols. How to prevent MERS? To prevent MERS, you can take the following measures. Practice good hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds. Alternatively, use an alcohol-based hand sanitizer. Maintain respiratory hygiene. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing and dispose of used tissues properly. Avoid close contact with individuals with respiratory symptoms. Maintain a distance of at least 1 meter, 3 feet, from anyone showing signs of respiratory illness. Stay informed about the MERS situation. Keep yourself updated on the MERS situation in the areas you plan to visit and follow travel advisories and guidelines issued by health authorities. Avoid close contact with camels and their bodily fluids. In regions where MERS is prevalent, avoid close contact with camels and their products, such as milk or meat. Practice good hygiene if you have contact with animals, including washing your hands thoroughly afterwards. Follow infection control practices in healthcare settings. Healthcare facilities should implement and adhere to appropriate infection control measures, which includes proper use of PPE, disinfection of surfaces, and hand hygiene protocols. Follow public health advice. Stay informed with the latest information and guidance provided by reputable health organizations. Cooperate with public health measures, such as surveillance, contact tracing, and quarantine protocols if advised by health authorities. Conclusion. Remember, while the risk of MERS transmission is generally low, it is important to take preventive measures to reduce the risk further. Practicing good personal hygiene, following respiratory etiquette, and staying informed about the latest developments will help protect yourself and others from MERS. We can work together to minimize the impact of MERS. Thank you for joining us. If you found this video informative, don't forget to like, share, and subscribe to our channel for more informative videos like this.